When the pathology first starts in the brain, it can start either in the brainstem, in the lower part of the brain that controls things like sleep and breathing and blood pressure. And we notice that those people may have more blood pressure issues, actually too low a blood pressure, or they have this unique sleep disorder called REM sleep disorder, where you act out your dreams. And then sometimes it starts in the amygdala. And when it starts in the amygdala, that seems to be most often associated with people who also have Alzheimer's disease going on. And in those individuals, sometimes it's just in that part of the brain, and when we see it just in that part of the brain, we don't always see the signal of the marker. I think most of us feel the real critical clinical question is when it goes beyond the amygdala. We think people with just what we call amygdala predominant disease in the context of Alzheimer's, they may go a little faster in terms of the progression of their disease, but otherwise they don't look like our Lewy body patients in terms of hallucinations and some of the other things that we see with that. But that's why we do this work. There is kind of this theory that in those that are positive, maybe the Lewy bodies are starting to leak out into other parts of the brain, and we're just not quite seeing it yet with our techniques that we use when we look at the brain under the microscope. Well, we're definitely a lot of in my own clinic, in my own center, as well as in some of the tertiary care centers, I think a lot of people are starting to use these aggregate assays in identifying people who have Alzheimer's and Lewy bodies or Lewy body alone. It does help us kind of give a more accurate diagnosis and at least manage some of the side effects of these diseases, and also predict like who might not respond well to a certain drug or might do poorly on a drug like an antipsychotic that you might use for hallucinations. So that can be very useful from that perspective. I do think this will ultimately leak out into the general neurology community, and I think, of course, depending kind of on what happens with the Lewy body specific therapies, whether we're going to be seeing kind of like we're seeing now with the amyloid therapies, some specific centers that are really focused on that. But I do think you're going to start seeing it go out into the community. The one big thing is that it does cost money out of pocket. It's not covered by insurance right now. That feels like maybe that's changing, and so we're hoping we get Medicare and insurance companies to start covering it so we can get it. I would get in everybody that I'm doing spinal fluid testing for Alzheimer's in. There are people working on an imaging ligand, and there are people, as I mentioned earlier, working on a blood-based, but that's all at the very experimental stage.